In this afternoon's Health Alert, it is a day to raise awareness. It is World Mental Health Day. 1 in 8 people worldwide are living with a mental health disorder. And in this country, 65 million Americans have a mental illness, and about 60% of them are not receiving the treatment they need. Mental health conditions can impact every aspect of our lives, from work to school and other settings.
We want to go ahead and bring in ABC's Chief Medical Correspondent Dr. Talk much more about this. Hi there, Jen. Thanks for coming in today.
Yeah, you know what? This is a top of mind, and not just today,
with everything that is going on
this
week, there is so much stress and anxiety as we see what is unfolding overseas and how it's impacting here.
And I think, first of all, why do we have that reaction? I think it's really important to understand that even though we're on the other side of the world, and as adults, we know that we're watching footage, psychologically, subconsciously, we are saying, that could be me. What if that were me? What if that were my child? And that psychological distress, that impact can be instantaneous, and it can compound. The more we see this, the more we think about it. And then for children, they may not understand, depending on their age, that what they're seeing is a replay of a video event. They think it's happening ongoing, which in some cases, of course, it is. So this is something that the appropriate and normal response is to feel a degree of distress when you watch something like this.
I got to ask you, we all have ups and downs, and we always deal with situations differently. But how do you know that what you're going through isn't a normal reaction to something versus a mental health crisis that needs some kind of a medical attention?
Well, I think if you are talking about yourself, you trust your gut, right? You know if you're struggling. I had to step away from live TV coverage watching it last night because I almost burst into tears. So if you're having a reaction like that, you need to limit your exposure to those things. You need to reach out, ask someone for help. It depends on the severity. If you notice that in someone else, David, which I think is a really important question, the first and most important thing to do is to tell that person, you've made this observation in a non-judgmental way. You are concerned. You want to support them, and that there's help available. And you don't have to figure out what that help is. You just need to help them access that help.
When we are talking about mental health in this country, there is an epidemic, I think, coming out of the pandemic of teenagers and college-age kids who are really struggling. So as parents, how is it that you can help bring that to the forefront of their lives and try to help them when they are also trying to be so independent?
Right. I think the most important thing is to treat it as you would any physical condition from the neck down, right? We're much better at saying, if you have high blood pressure, let's manage it. If you have a broken arm, let's manage it. So I think when you speak to your child, age dependent, of course, because it will differ based on their ages, you want to reassure them that the checkup from the neck up should be thought of no differently than anything physical. And that awareness should go on every single day, not just today on Mental Health Awareness Day, but we cannot talk about this enough. It should affect and does affect all of us.
Everyone.
We have to treat mental health like any other disease in many ways.
Absolutely.
Instead of
That's
stigmatizing
stigma.
it.
Exactly.
That's the first step. Thank you, Jen.
Really appreciate it.